Hi, I'm Dr. Rohit Madhurkar, Consultant Interventional Radiologist at Pinhole Clinic and Apollo Hospitals, Bangalore. Ultrasound or CT guided biopsy is a very simple procedure wherein, like how you draw your blood, you show your hand and they find out the vein, put a needle into the vein, draw the blood. In this ultrasound or CT guided procedure, deeper structures in our body which cannot be visualized are visualized on the scan. Now, how we do an ultrasound, we put the probe on the patient, then I can see the lesion maybe 4 centimeters, 5 or 6 centimeters deep from the skin, and this lesion is seen, identified, and the target area is documented. After this, we pass a thin needle to give local anesthesia in your skin and then pass the biopsy needle deep under the guidance, making sure that we do not come into contact with any major blood vessels or structures on its way, get to the lesion and put in the biopsy needle and take multiple course. Now, under image guided, in a broad heading, we call it image guided biopsy for ultrasound and CT guided biopsy, wherein we can see the organ or the target lesion, may it be cancer or non-cancerous lesion, which we have to biopsy. In this procedure, it is very simple. The patient comes 3 to 4 hours of fasting with few blood tests done prior, wherein we know the blood is thin or thick, how much are the platelets, PT, INR, all these are documented, and the patient is counselled and consented. After this procedure, the procedure usually takes 20 to 30 minutes, wherein we go into the target area and take the biopsy. So, which are the areas we can take biopsy? From head to toe, like thyroid lesions, FNA biopsy, or neck lymph node biopsy, lung biopsy, mediastinal biopsy, liver biopsy, very commonly done day to day, some retroperitoneal biopsy, inguinal lymph node biopsy, axillary lymph node biopsy, breast lesions, which we do biopsy. Different areas of biopsies, we use different sizes of needle to get the tissue. Once this tissue is extracted, then we send it for different kind of tests to identify whether this sample is tumor or malignant tissue or a benign tissue or any infection. Similarly, if there is an infection or a pus collection somewhere, we put in the needle and remove the pus, and this is sent for infection workup. Many a times in our country, TB is very common or any other infection. So we go inside in a guided way, which is the most precise, accurate way of removing a tissue without causing any damage. Now, let me come to the key point of this procedure, that is, this is unlike the olden days where they used to open up to do these biopsies. Here, we do not have to open up the patient. It happens through a pinhole. It's a daycare procedure. Come, get it done, observe for 2 to 3 hours, and then go back home. The tissue processing takes around 48 hours to get to know what is the tissue and what is the diagnosis. Based on that, then your treatment starts. So, what complications can we have after we do this biopsies? Like anything, we get hit somewhere, we may get injury or bleed. So now when I stick in a needle into your body, there is a chance that you may have a bleed. And these bleeds are usually not torrential because we are doing it under image guidance and we are avoiding all major structures or blood vessels which are coming on our way and taking the biopsy. So even if there's a bleeding, we always categorize all the complications as mild, moderate, severe. Mild, nothing to worry, you can go back home. Moderate, we observe for longer hours and reassure if there is nothing and recheck if there is nothing more happening. In severe form, mostly we may keep you for a day in the hospital for observation and then send you the next day. Now, different body parts have different added complications apart from bleeding, especially in the lungs. When we do, lung is like a balloon, so when we prick, the balloon may deflate inside and cause accumulation of air within the cavity of the chest. So this is called pneumothorax. So in form of, when we have a pneumothorax, nothing to worry, small pneumothorax seals on its own. A larger or moderate pneumothorax we observe, large pneumothorax we may have to put in a drain and remove all that air that has got accumulated within the chest wall. Similarly, in liver, when we do, which is one of the most commonest biopsies that I do. So in the liver biopsies, when we do a biopsy, there is a chance of bleed to be more than any other lymph node biopsy or a breast biopsy. So we plug this tract. We use a special gel where this tract is where we have gone through the needle and the area of biopsy is plugged with the gel, and this gel forms clot formation and prevents the blood to leak from there and cause bleeding. Overall, in nutshell, biopsy is a daycare procedure, a pinhole procedure, no cuts, no sutures, and it gives you more accurate diagnosis. This percutaneous biopsy is what we gives you good, very two important factors of this whole video is Q and Q. This is my favorite word. I mean, which is quality and quantity of tissue that we remove will help us give us not only a histopathological diagnosis, also proceed with further test if it has to be done if required. You do not have to undergo repeated multiple biopsies. It's a predominantly pain-free procedure, and you'll have a bandage for 4 to 6 hours. You can shower the same day. You can get back to your routine the same day or the next day morning. You have more queries, feel free to ask your questions. Thank you.